Hello, ladies and gentlemen. My name is Gabriel Soriano. I am medical English student. My teacher is John Moscoso. My topic is disseminated cryptococcosis. First, introduction. Cryptococcosis is a common opportunistic infection among immunocompromised individuals. Some of the commonly affects sites are respiratory and central nervous system. Lymph nodes is an unusual site of involvement which could mean tuberculosis.
Cryptococcosis is the disease caused by the fungus Cryptococcus. Cryptococcus is a type of fungus that is found in the soil, usually in association with bird droppings. The major species of Cryptococcus that cause illness in humans is Cryptococcus neoformans, which is found worldwide. Another less common species that can cause disease in humans is Cryptococcus gatti. Since 1999, Cryptococcus gatti has also been found in regions of the Pacific Northwest, particularly in Vancouver Island in British Columbia and Oregon and Washington in the United States. Cryptococcus neoformans typically infects immunocompromised persons. Most people in the United States who develop this infection are HIV infected or have other conditions affecting their immune system. However, occasionally persons with no apparent immune system problems develop cryptococcosis. A wide range of animals can also develop Cryptococcus neoformans cryptococcosis. The spores from Cryptococcus neoformans live in bird droppings, especially pigeon droppings, and in soil contaminated with bird droppings. Humans can get cryptococcal infection by the inhalation of airborne fungi, which are spread from these sources. Cryptococcosis is not known to be spread from person to person, animal to animal, or from animals to humans. Infection may cause a pneumonia-like illness with shortness of breath, coughing, and fever. Skin lesions may also occur. Another common form of cryptococcosis is central nervous system infection. Symptoms may include fever, headache, or a change in mental status. To prevent Cryptococcus neoformans infections, people who have weakened immune systems should avoid areas contaminated by bird droppings and should avoid contact with birds. Infections with Cryptococcus gatti have occurred in both healthy persons without compromised immune systems and in persons with conditions affecting their immune system. A wide range of animals can also develop cryptococcosis from exposure to Cryptococcus gatti. Its spores appear to live in association with certain trees and the soil around trees. Humans can become infected by the inhalation of airborne fungi, which are spread from these sources. These are just a few things to know about Cryptococcus fungi. To learn more, please visit the website shown on the screen.
Application in medicine. Based on extrapolation from later discrete management of patients with HIV infection treatment for immunocompetent patients with mild to moderate pulmonary cryptococcosis in the absence of diffuse pulmonary infiltrated or disseminated infection consists of fluconazole for 6 to 12 months. If fluconazole is not available or is contraindicated, acceptable alternatives include itraconazole, voriconazole, posaconazole, delayed release tablets, or isavuconazole. Also, there are minimal data available regarding the later agents.
Cryptococcus neoformans grow a capsule to defend themselves from our immune system. But our mighty white blood cells are usually too powerful for the tiny fungi. But in HIV/AIDS patients with weakened immune systems, it can cause some serious complications like pneumonia and meningoencephalitis. Let's discuss the interesting case of Cryptococcus neoformans today on Tiny Medicine. Cryptococcus neoformans is a unicellular fungus, and therefore a type of yeast. It lives worldwide in soil, plants, and in the droppings of some birds like pigeons. It's not contagious, and you get the infection by inhaling the fungal spores from the environment. An estimated 220,000 cases occur worldwide each year. Most of these cases are reported in patients with HIV/AIDS. The infection is usually asymptomatic if you have a good immunity. But in some cases, the fungus can remain latent in the lungs and reactivate if your immunity gets weakened someday due to old age or a medical condition. Now let's talk about immune-compromised patients. When the CD4 white blood cell count is lower than 250 in HIV patients, it's called AIDS, or acquired immune deficiency syndrome. As AIDS gets advanced, the risk of Cryptococcus neoformans infection becomes greater. Other than HIV/AIDS, people can have weakened immunity due to chronic diseases, organ transplants, and long-term use of immune suppressive medications. Since the fungus is transmitted by inhalation, they first develop lung infections like pneumonia, cough, shortness of breath, fever, and chest pain that exacerbates with respiration are the symptoms. It can spread through the bloodstream to the brain and cause meningoencephalitis. Symptoms are fever, headache, neck stiffness, photophobia, seizures, altered levels of consciousness, nausea, and vomiting. Treating HIV patients with cryptococcal meningoencephalitis can be challenging. If the CD4 white cell counts increase rapidly, they can flood the brain and cause a potentially fatal condition called immune reconstitution inflammatory syndrome, or IRIS. It can cause permanent brain scar. Diagnosis can be confirmed by staining cerebrospinal fluid with India stain to visualize the fungus. Detecting fungal antigens from serum and cerebrospinal fluid has a high sensitivity. But the gold standard test is to culture the organism from human body samples. Asymptomatic and mild to moderate pneumonia patients are treated with fluconazole for at least 6 months. Severe pneumonia and meningoencephalitis are initially treated with a combination of amphotericin B and flucytosine, followed by an extended course of fluconazole. Thanks for watching it. I make animations about interesting medical.
Pros and cons. Pros. Fluconazole has been shown to be effective in most cases. Cons. There is minimal data available on the other drugs apart from fluconazole. Ecuador. Cryptococcosis in opportunist disease is a threat to immunosuppressed patients. Despite the great impact it has worked with, in Ecuador there are few studies in this regard.
Ian is thriving on Vancouver Island. The BC Centre for Disease Control says the island has one of the highest rates of cryptococcus infections in the world. We have shown you that before. Now, doctors in Calgary have made a medical breakthrough that they say may come up with a way to fight the illness.
When these signs first went up in Parksville's Rathtrevor Park, fears of a toxic fungus swept Vancouver Island. More than 10 years after Cryptococcus gattii first showed up in island fir trees, people aren't as worried about spending time outdoors.
I come down here 2 or 3 times a week, and I'm well aware of it, but it's not going to happen to me.
It doesn't concern me, really, because I think we're surrounded by a lot of germs and fungus and so on.
Like inside the brain?
Now researchers at the University of Calgary say they've made an important discovery which could lead to better treatment of Cryptococcus disease, a rare but deadly infection which begins as pneumonia but spreads to the brain, causing meningitis. Until now, little was known about how the fungus seen here in white leaves the bloodstream, the dark areas, and enters the brain.
What we discovered is how it gets to the brain, why it stops in the brain, and then we used a drug, to actually block that process.
Doctors say this key observation could lead to better treatment.
We now understand why it is that it causes the brain infection. And we've got to start to figuring out therapies that might actually block that process.
Testing was done on a mouse using a drug already approved for other medical uses. The findings are published in this month's Journal of Clinical Investigation.
If it doesn't get into the brain, then it's much easier to treat. And so I think that this has been, in my opinion, a real advance, a huge step forward.
Since 1999, 270 people in BC have become ill from breathing in the fungus, most traced to Vancouver Island. That makes the island number 3 in the world for the infection.
Up until 12 years ago, when it first appeared on Vancouver Island, it was only known to exist in tropical countries like Australia, South America, Africa.
Why it took hold on the island, scientists don't know. What they do know is that Cryptococcus is spreading. It's now on the lower mainland through Washington State and Oregon.
Global warming is actually allowing some of these fungi to live happily in our environment. And so I think we're going to see more and more of this kind of emerging infections.
Doctors stress Cryptococcus disease is rare, but it does kill about 1/4 of infected people. Researchers hope to perform clinical trials of the drug in the next 12 to 24 months. In Victoria, Astrid Brownschmidt, A News.
Conclusion. A large segment of the population has been exposed to Cryptococcus neoformans. Subclinical primary infections are common, and most are asymptomatic. Infection can persist in a latent state. If the host immune system becomes compromised, organisms may be liberated from the granulomatous complex and cause active infection.
Everyone. Over the next 35 to 40 minutes, we'll be discussing about a very important opportunistic fungal infection, Cryptococcus neoformans. This is the outline of my presentation. I'll be talking about the etiology, that's the fungus itself, the pathogenesis, how does a saprophytic microorganism become a pathogen, the clinical features, how does these patients present you, and finally, a word about the management of this infection. Cryptococcus is a basidiomycete fungus. It's been called the sugar-coated yeast because of its polysaccharide capsule. So it's an encapsulated yeast, the capsule being the polysaccharide. Primarily, this species is an environmental saprophyte. It's found in soil contaminated with desiccated pigeon or chicken droppings. Only two among all the species are human pathogens, and they are Cryptococcus neoformans and Cryptococcus gattii, which are subdivided into several genotypes. How does this environmental saprophyte become a pathogen? This primarily causes disease in patients with defective cell-mediated immune responses. And globally, the most important risk factor for cryptococcal meningitis is patients with HIV infection. Other conditions which depress cell-mediated immune responses, for example, glucocorticoids therapy, long-term iatrogenic suppression, solid organ transplant recipients and hematological cancers are at increased risk. But it's important to understand that today we are seeing increasing numbers of patients with no identified underlying risk factors. So because the patient does not have any known immunodeficiencies, do not discount the diagnosis of cryptococcal meningitis in the appropriate setting. The fungus enters the host by inhalation of either the yeast, dried yeast, or the basidiospores. And the initial focus of infection in the lung, which is asymptomatic in the vast majority of individuals. The virulence factors in the fungus are, the most important virulence factor is its polysaccharide capsule. This capsule inhibits phagocytosis by neutrophils and macrophages. It also has the ability to downregulate cellular and humoral immune responses. The fungus also produces chemical compounds like melanin and mannitol, which will inhibit phagocyte function. So these are the important virulence factors of the fungus. The most common clinical manifestation produced by Cryptococcus is a meningoencephalitis. It can cause a disseminated infection. It can have diseases in other organs like lung and bones and prostate and skin.
Thank you for paying attention.